Hi, my name is Connie, and today I want to talk about autoimmunity, what it is, what causes it, and what you can do about it. It's a very personal topic for me because I too have an autoimmune disease, lupus. And back 20 years ago, there was very little information about autoimmune conditions. Autoimmune conditions are on the rise. They affect over 50 million Americans and are considered a top 10 leading cause of death in women under the age of 65. We now know so much more about autoimmunity, and today I want to share everything I know about the disease so that you can be better informed. So what are autoimmune diseases? Well, there's many different presentations of autoimmunity, including rheumatoid arthritis, type 1 diabetes, thyroid disease, lupus, psoriasis, multiple sclerosis, etc. So all autoimmune diseases share a common root cause. They all stem from systemic inflammation. Let me explain. So our body's immune system defends us from foreign invasion, specifically from bacteria, parasites, and viruses. And typically, such invaders enter our body through a cut on our skin, a nasal passage through the air we breathe, or an oral passage, which leads to our gut. Our bodies have barriers such as our gut lining and our skin, and as long as our barriers keep our foreign enemies out, we're good. However, in today's world, we have increasing attacks to these barriers from toxins, decreasing our protection. The toxins are everywhere, from the air we breathe, clothes we wear, foods we eat, to the stress of our lives. Toxins are compromising our body's natural defense system, and we're collapsing. When our immune system is overworked, it starts to lose the war against foreign invaders. So when allergens, toxins, and infections are introduced to our body, our immune system begins to make mistakes. It starts to get confused and can't differentiate friend from foe. It mistakes certain types of tissues for harmful substances, and gradually, your body starts to attack its own organs and tissues, thinking they're foe. And the body's ammunition against foes are called antibodies. And as the antibodies multiply, they then start to destroy your organs and tissues, causing systemic inflammation. So think of it as a fire gone out of control, and it's become so big that it can't be contained. It's a scary process, one that needs to be avoided and prevented at all cost. So what causes autoimmune diseases? Well, there are many factors that can cause an autoimmune disease. Substantial evidence points to the genetic component. However, when these genes are expressed or turned on, the disease is actually caused by a host of other factors, such as toxins from heavy metals like mercury, mycotoxins from molds, infections like Candida, Epstein-Barr, and the herpes simplex virus, and most significantly, chronic inflammation tied to food sensitivities, particularly gluten. So as I mentioned, we live in a highly toxic world. While the Industrial Revolution brought many benefits, some disadvantages it brought include alterations in our lifestyle, specifically in the way we eat, and the promotion of a sedentary lifestyle. In addition, we have become overstimulated and stressed which collectively causes an imbalance in our bodies. So what are some signs of autoimmune disease? If you're experiencing any of these symptoms, especially a combination of several of them, you may have an autoimmune disease. One is joint pain, muscle pain, or weakness, or some tremor. Weight loss, insomnia, heat intolerance, or rapid heartbeat. Recurrent rashes, hives, or sun sensitivity, a butterfly-shaped rash across your nose and cheeks, difficulty concentrating or focusing, feeling tired or fatigued, or weight gain or cold intolerance, hair loss or white patches on your skin or inside your mouth, abdominal pain, blood or mucus in your stool, diarrhea or mouth ulcers, dry eyes, mouth or skin, numbness or tingling in the hands or feet, or multiple miscarriages or blood clots. It's important to understand that there's a spectrum when we speak of symptoms, because symptoms are so varied and wide. Unless you conduct specific tests, autoimmune diseases can be hard to diagnose. It's also common to have symptoms a long time prior to being diagnosed, as it was the case for me. What should you do if you suspect that you have an autoimmune disease? Well, if you do have a diagnosed autoimmune disease, you must see your rheumatologist. They will likely perform some labs to check for antibodies in order to differentiate the disease. They'll provide you with medications to suppress your immune system and decrease inflammation. While such medications are effective at suppressing the symptoms, they fail to address the root cause of your disease and how to potentially reverse the dysfunction. Also, when taking it long term, they can potentially have detrimental side effects, such as cancer. And if you have severe symptoms, it's imperative that you stay under the care of your rheumatologist to manage the progression of disease appropriately. However, a thorough understanding of your condition requires an extensive evaluation, preferably by a trained functional medicine provider. This is to create an effective antidote to progression of your disease. This will also ensure that you get on a protocol that will promote an overall balance in your body. I've lived with lupus for over 18 years and suffered from symptoms for over 22 years. I've also treated many patients with various autoimmune conditions, and I can tell you, no two cases are the same. However, I can confidently tell you that you have the power to make a difference in the way you manage your disease. The Alkaline Health Matrix. So let me explain this matrix. There are 3 elements involved in your health. 1 is gut health, 2 is neuromusculoskeletal health, and 3rd is brain health. So gut health is all about learning what to eat, what foods to eliminate, and what supplements to take to optimize your health. And neuromusculoskeletal health is all about movement. When I was sick, the last thing I wanted to do was to move. I was told to rest. And while I had to strike a smart balance between too much and too little, I now can share what specific exercises you should do to make sure that you preserve your nerves, muscles, and joints. Brain health involves healing, guided meditation that allows for mindfulness. Often we're crazed with to-do lists. We don't spend time to simply unwind. Rather, we're constantly on our electronic devices, and as a result, our brain doesn't get an opportunity to reboot. This is where the behavior shifts can occur, and because without the reboot of our perspective, no change will happen. Lastly, at the core is the balance between the 3 elements. If they're in balance, then I assure you that you'll activate and experience your body's miraculous ability to heal. It's inherent in all of us. I've had to resort to immunosuppressive medications, but I chose to take matters into my own hands and reclaim my health. I got busy applying the above elements to my life, and the results are astounding. While I'm still a lupus patient, it's my goal to one day fully be able to reverse my condition. I would love to hear from you. Please share this blog with anyone that may benefit, and subscribe to my channel on YouTube or sign up to my newsletter on my website to get more information like this. And thanks for your time.